And all of this week you're going to be looking at the NHS in Sussex, how it's coping and looking after all of this.
Yeah, how it's coping with COVID and trying to create normal services, get back to some sort of normality. They've invited us in to have a look. Tonight I've been talking to frontline staff at the Sussex Community Trust. I think the first question for the chief nurse at this community trust has to be, where exactly does the organisation fit into the wider NHS?
So we often talk about community services as being the glue in the system. So we do both. We're at both ends. So you have an acute hospital in the middle and we're either side of that. So we both support people to manage their health conditions at home. And then what we also do is that we go into hospitals and we make sure that the discharge of patients is safe.
I'm wondering whether you feel you're the Cinderella service in this.
Absolutely. And I think particularly from a community nursing perspective as well, I think the media during the pandemic or the initial waves of the pandemic were very much focused on intensive care units and hospitals. And actually our community nurses, both for children and adults, were going into patients' homes and care homes and keeping those patients healthy and well, or caring for them at end of life, all the way through the pandemic.
So Donna's left us, but she's also left some quite interesting numbers about the trust. Here they are, 5,500 staff, 800 community nurses. In the last year, those community nurses have made 650,000 home visits, and across the trust they see 9,000 patients face-to-face every day in Sussex. And for those who actually deliver that care, the last 2 years have been tough, but without their efforts, the wider system would have struggled even more.
Unfortunately, we've had to defer some patients because other patients have become poorly and we've had to sort of manage their symptoms. So it's, it has been put a lot of strain on the service.
I think we're quite a hidden service in what we provide, and especially with the complexity of patients that we look after in their own homes to prevent them going into hospital. It is an important service and I think it needs more recognition.
Diabetes, wound care, end-of-life care and hospital discharges. There isn't much this trust doesn't have to deal with, as it supports both the wider health system and the 1.1 million people who live in Sussex. Mark Norman, BBC South East Today, Brighton.